Welcome to Communication Skills. This is a community dementia education program of Alzheimer's San Diego. My name is Amy Abrams, and I am the Director of Education for Alzheimer's San Diego. Very pleased to be joined today by my colleague, Jean, who will be co-presenting this webinar with me.
Hi, everybody.
And we are Alzheimer's San Diego. We're a local nonprofit organization headquartered in the Kearny Mesa area of San Diego County and serving people anywhere who either are living with dementia or care for someone who is living with dementia. Here is our agenda for the Communication Skills program today. I'm going to start by talking briefly about dementia symptoms and the impact that they have on a person's ability to communicate. We'll talk about behavior as well, behavior as a form of communication. Then Jean is going to get into the tips, the tricks, the strategies for having effective conversations for verbal communication, but also for communicating and connecting in nonverbal ways as well. Then I'm going to talk a bit about behavioral expression as a form of communication, kind of understanding it, and then we will wrap up by making sure that you're aware of additional resources that are available for ongoing support. So start first talking a little bit about dementia itself, just to kind of lay the foundation, the groundwork in terms of using common language and having a common understanding of what we mean when we use the term dementia. It's not one specific thing. It's not a particular disease. It's a group of symptoms. We refer to this group of symptoms as dementia. Symptoms that are caused by some underlying medical condition. That is frequently Alzheimer's disease, but there are numerous, dozens of different types of dementia that could cause this range of symptoms. So dementia is not just a memory problem. It affects multiple domains, which you see listed here. And the impact, the effect is not minimal. The changes are significant enough that they're interfering with the person's normal daily function. So we're talking about changes in memory, but also language, the ability to focus, concentration and pay attention, problem solving, being able to apply reason. One of the common problem solving challenges we see in people with dementia is being able to sort of read another person's kind of mood or expression, or sort of having empathy for other people. We'll talk a bit about that. Behavioral changes. Often a person's personality will change significantly during the course of the disease. For better or for worse. All of these changes are not always negative, by the way. They're just a marked change from what was normal for that person. And finally, it is important to know that there are often very significant changes to a person's visual spatial abilities, meaning their ability to see what's in their periphery, their ability to interpret depth, contrast, right? How far away someone or something is, for example. Very common. These are just a sort of a quick overview of the symptoms and the most common of them, but there certainly are others. And every person's experience of dementia will be unique because, of course, the human brain is magnificently complex. There are billions of brain cells in there and billions more connections between them. So what individual symptoms and one specific person will have really depends on many things: what kind of dementia they have, what the pathology is, what part of the brain is impacted or impacted most heavily, and other health conditions, right, that affect the overall health of their brain. So it's very hard to predict exactly what symptoms any individual person will have, but just to sort of put the dementia symptoms and those difficult, frustrating communication challenges into perspective, we like to just give you a quick walk through the different regions of the brain and what they're controlling. The temporal lobes, the purple region, the sort of center of our brain, kind of back behind our ears, between our ears, is very involved in memory, specifically short-term memory creation, storage, as well as language. Not not just verbal language, also being able to interpret what we read. The temporal lobe is where the Alzheimer's type of dementia for many people starts. And so that's why memory and language changes begin so early for many people. The typical progression of the Alzheimer's pathology is that it would start in the temporal lobe, then move up into the frontal lobe, the yellow region that you see on the diagram there, then move to parietal lobe, occipital lobe, and cerebellum. Move is the wrong word. Spread is more accurate, right? Once the disease is present in the frontal lobe, it's still also in the temporal lobe. So when the disease has spread into the frontal lobe, we will start to see changes in a person's ability to sort of organize their thinking, do problem solving, executive functions, making decisions. This is also the seat of our sort of what drives our ability to regulate our emotions. And so a lot of our behavior is kind of directed in this part of the brain. And very importantly, that empathy ability. The ability to see something from the other person's perspective. That's a very complex cognitive skill, and it is impacted significantly in a lot of people with dementia. When the disease has moved into has spread into the parietal lobe up at the crown of the head, we'll see more difficulty with sensory perception, more complex word and thought formation struggle. This is the seat of a lot of the confusion and disorientation that we see in people that are living with dementia. And then in the back of the brain, the occipital lobe is very involved in our vision, the cerebellum, also vision, balance, fine motor skill, and a lot of our kind of essential involuntary bodily functions. So it may seem strange to get a little bit of a sort of biology, physiology lesson here in a communication skills class, but I have found over the years working with people living with dementia, knowing in my personal life many people who have lived with dementia, how helpful it can be in those moments of pain and frustration when someone doesn't recognize you, when somebody accuses you of something that is unfair, says something that is untrue, or just those moments where you feel like, are we living on different planets? How are we seeing this situation so differently? It can be very helpful to come back to this image of the brain and remember this is a symptom of this person's disease, right? We aren't seeing this. We literally are not seeing this situation the same way because of the presence of that disease. I know we've already received some questions about just how can I be more patient? How can I be more kind in those moments that I'm so frustrated? And we'll be talking about that here today. I will ask you just try to keep this, this sort of image in mind, remembering that what this person is experiencing, doing, expressing, these are symptoms of their disease. So what might that actually look like when it comes to verbal communication specifically? We often see the person struggling to find the right word or having a hard time understanding your words when you're speaking. So this can present in a couple of different ways. We may see people using the wrong word, right? Just saying plenty of words, but they're not stringing them together. Or there just might be a lot more pausing, a lot more silence, or a lot of kind of verbal withdrawal, just not speaking as much. Many people with dementia, just because of the way our prefrontal cortex is wired, many people with dementia will retain the ability to understand and comprehend accurately what they see longer than they will be able to understand what they hear. This is a very important thing to understand, and Jean will be talking about this more when we get into strategies and tips. But it can be hard as the brain cells are being damaged. It can be hard for people to connect what they see with what they hear, right? The visual of a door opening and the sound of the door opening or the person saying hello. Right, all of those sensory inputs don't necessarily process at the same time, at the same rate, the way that they used to. On a similar note, it can be hard for people with dementia to filter out background noise or other distractions, visual distractions. Very common for people with dementia to become frustrated during a communication, right? If Jean and I are having a conversation and I say something that she just doesn't really get, right? She can just say to me, "What, Amy, that didn't really make sense." Or she can even tell me that with a facial expression, right? Just letting me know, I don't understand what you just said. If both of our brains are healthy and we're, well rested and well fed and in decent moods, neither of us are going to get angry in that situation, right? We're just going to all say, "Oh, sorry, I don't know what, let me try that again," right? I'll find a different way to do that, to say that or communicate what I was trying to communicate. That's a very complex cognitive skill right there, right? To perceive that, "Oh gosh, that didn't make any sense. Let me try that a different way." That's not possible for a lot of people that are living with dementia. So what we see instead is frustration, right? In the form of some kind of a behavior, lashing out, saying something that's unkind, or maybe even just withdrawing from the conversation altogether. An important thing to know for individuals who speak more than one language fluently is that the primary language, the language we learned first, is likely to remain stronger as the disease progresses. So sometimes we'll see people kind of reverting back to the first language that they learned when they were children, and kind of coming in and out of different languages. And sometimes caregivers think the person is doing that on purpose, right? Well, she knows I don't understand her native language, and that's why she's speaking in Japanese all the time now, right? And not probably something that the person is doing on purpose. This is a common symptom. And finally, last but certainly not least, one of the most frustrating symptoms that we see in people with dementia is repetition. Like saying the same thing over again, over and over, or asking the same question. Repetition is usually about questions. What time are we going again? Why do we have to go? Who's going to be there? Just ruminating on the same question and asking it over and over again. This is a very important concept in discussing communication. And again, this is something I've already received a question about. What do I do when the person just really doesn't know or understand that they have dementia? It's a very common challenge. So anosognosia is a condition that affects about 50% of people who are living in early and middle stage Alzheimer's and other forms of dementia. Anosognosia, it's I think kind of a beautiful word, a frustrating condition, but it comes from the ancient Greek for without disease knowledge. And this is something most of us who've known individuals with dementia are well familiar with. Somebody who just doesn't seem to think anything is wrong with them. Right? We might interpret that as denial, but it's usually not actually denial. It's a true lack of insight, right? Not having an awareness of my own disability. Anosognosia happens in many medical conditions and mental health conditions. It's especially prominent and common in people who are living with dementia. So the occupational therapist, Teepa Snow, provides a great deal of information on this topic. She's a wonderful resource for all types of dementia education. And so we've provided her website there on the slide, and certainly refer you there for more information. We incorporate, Jean and I are both certified in her method of dementia training. We incorporate a lot of her knowledge, her information, and her techniques into our education programs. This is one of the most important concepts. Understanding that a person's insight into the changes that are happening with them has to determine a lot about how we communicate with them, right? If a person is not aware that they're having memory loss, right? They don't remember what they don't remember, or they don't even remember that they don't remember. We have to come at our communications very differently. So again, about 50% of people in the early stages are experiencing this. Certainly as the disease progresses, we see more and more people with dementia don't have insight into their disease process. About 20% of people who are living with dementia know that something is changing, right? I am having problems with my memory. I do feel I can't do things the way I used to do them. And their reaction to that is to get sort of angry and to feel very controlling about it, right? Well, yes, I'm struggling, but if everybody would just kind of stay out of my business and let me stick to my routines and, stop coming in and moving things around in my house, then I would be fine, right? We refer to those as the 20 or so percent who are aware of their changes and they feel sort of angry and controlling about it. And then the rest, about a third or so, 30%, have an awareness. Yes, my memory is a problem. Things are changing with me, and I feel very anxious about it. So these are the folks who really worry about you when you're gone or when you're just out of sight for a little while. They know they need to rely on you in new ways. They're very anxious. These will be the folks that ask a lot of questions about what time are we going? What time are we going? How long are we going to be there? Right? Feeling very anxious about the skills that they are losing. So when it comes to communication, we really want to sort of be realistic in our aim in our communication, setting realistic goals based on what this person's level of insight is right now, recognizing that it can change. But generally, if you're interacting with somebody who has anosognosia, they are not aware of the losses that they're experiencing. They're not aware that anything has changed. They think everything is, it's you guys. You guys are the ones who are struggling, right? Then our goal is to change their attitude about what we're talking about. So if this is, we're trying to have a communication about, we shouldn't be driving anymore. I really need to get the car keys away from this person. Having a conversation about that with somebody who's not aware that anything has changed with them, we're going to get absolutely nowhere trying to convince them that they're no longer a safe driver, right? All they remember is, I've been driving skillfully for 40 years. Who are you to tell me that I'm no longer able to drive? I don't even know what you're talking about. Right? You can present them with all the evidence, make a solid case, but if they're not aware that things are changing with them, right? They literally don't remember that incident of getting lost in the parking lot, or yeah, I don't know why there's all these new dents on the car and have anything to do with that. Somebody must be hitting my car while it's parked in the driveway, right? They're not making things up. They're not trying to fool you or pull a fast one on you or deny. They really don't know. Right. So our goal is to not get into an argument, not draw attention to all the things that they can't do anymore. Instead, we just want to make them feel differently about the fact that someone else is going to start doing the driving. Right. Well, I have this nice, new, comfortable car. Why don't I drive? Right. Changing their attitude toward that thing rather than trying to convince them that something is wrong with them. With folks who are aware that things are changing with them and they feel angry and controlling about it, we just want to stay connected with them. Again, not pointing out all the things that they're doing wrong, not trying to step in and fix what they're doing, but just, sort of quietly behind the scenes, making those little adjustments, not being sort of direct and confrontational about things. We're going to give you some tips on how to do this. And then with folks who are aware that, yes, I'm experiencing memory loss and they're very anxious about it, we really want to just make sure they feel reassured all the time. We're a team. I'm here for you, right? It's really okay. Your memory changes, these ability changes and skills that you've lost, they don't scare me, right? We're going to be okay. We're going to get through this together. We want to keep that person's sense of what they're good at, what value they bring to the table, what their daily purpose is. We want to keep all of that in mind with them. Very hard reality to confront when it comes to living with, caring for, or just caring about someone who is living with dementia. The reality is your relationship with that person is changing. We don't use the narrative, we don't buy the narrative that people with dementia are going away, that we're losing them, that they're gone at Alzheimer's San Diego. Things are definitely different. Things are changing. You are losing your shared history together, right? You are now the keeper of all those memories that you have. if they've lost them, when they eventually lose them. But that person is still there, right? But your relationship undoubtedly has already changed, and it will continue to change. They can't change what's going on in their brain. This class is not about getting them to communicate better. This is not about getting them to stop repeating themselves, right? This class is about us adapting, us changing our responses to what's going on with them. Do recognize too, you are changing too, right? Because we're humans, and we grow and we adapt and we develop and change over time anyway. But in the presence of this disease, this diagnosis, in the course of being a caregiver or a care partner to someone else, you are changing, right? Maybe in some ways for the good, maybe in some ways for the bad, but you are both changing and evolving as this disease progresses, and so too is your relationship. So let me just kind of pause and give you a chance to take a deep breath. And I just went through a lot about all the stuff that's kind of going wrong, and the wiring of the brain, and brain cells dying, and functional losses and challenges and changes in both of you. A lot has changed, undoubtedly. But some things have not changed, right, about you and also about them. So what I want to encourage you to do, and you can just do this sort of personally, privately, write it down or think about it, but you're also welcome to share in the chat if you would like to. Think of for a moment here about what hasn't changed about this person. How is the person that you care for, or if you care for multiple people, think about one of them right now. How are they still the same today as they were before they had these changes in the brain? What are some of the things that they love, that they've always loved and that they still love? What's an activity that they enjoy? What's something that they were always really good at that they're still good at? Maybe they do it differently now, but they're still really good at it, right? I think about people who always made Thanksgiving dinner and, sort of knowing how to pull a big fancy meal together was always a real skill and forte, and something that they really enjoyed. Well, that may be different today, but can they still, right? They really know how to carve the turkey, or they really know, those tricks to the perfect cranberry sauce, for example. What's something that they have always needed from you that they still need from you? Is that feelings of love, support, shelter? What about your relationship with them has not changed? If any ideas are coming to you, feel free to write those in the chat. Jean, is there anything you want to share?
Well, there is, and I just really like it, and I think you will too. Amy is one of our attendees, says that her dad still retains his sense of humor.
Yes.
That's such a great strength.
Totally. And it is such a complicated thing about a person, right? Their sense of humor. It probably has changed in some ways, but at its core, right, the things that were always really funny to them are probably still pretty funny to them.
Yeah.
Cool.
That's a gift. And, here's another really lovely one. This attendee is saying that her person living with dementia, that her heart has not changed. And she's just as loving as ever, with hugs, smiles, kisses, loves to hold hands.
Very nice.
Yeah.
Very nice. Oh, what a gift. Wonderful. Those are some great examples. Please keep thinking of, those are perfect examples, and just what we had in mind, right? Those things that are core about that person. I see one there, just hanging on the patio with a beer, right? If somebody always really loved doing that and they still love doing that, right? Think about those things about that person. We are going to come back to this a little bit later. They're very, this is not an unimportant exercise.
Absolutely. And it speaks to, sometimes just the simple things. Yes. Like having a beer on the patio and holding hands.
You got it.
Yeah.
Okay. Jean, the floor is yours.
Okay, so I will step in virtually. And we're going to talk a little bit about, you know, the strategies we can employ to hopefully have more effective conversations, connections, and communications with people, with our people who are living with dementia. And, you know, before I go on further with that, let me just say, you know, I love this class. And every time I'm kind of preparing for this class, and I was thinking about it last night, is not always, but sometimes I'm able to apply these strategies to my own life. So let me just say, communication is challenging, whether there's a diagnosis of dementia in the household or in a life or not. How many folks here have in the past week had some kind of miscommunication or disagreement, or just, you know, communication has kind of gone haywire with anybody in their life? Me too, last night here in my house with my husband. Imagine that, huh? And, you know, I want to give you, he came home from work and he made a remark about that I hadn't done something. And for context, I just want to say to everyone, we just got back from being away for a few days. So yesterday was like my Monday at work. And the thing he was referring to that I didn't do was not a 5-minute or 10-minute thing. It's probably going to be a couple of hours. And so when he said, "Why didn't you do that?" You know what I wanted to say right away? What, you think I've been sitting around all day eating bonbons? Now, I didn't say that. Yay, communication skills class. So because I did take some time in my head to formulate my response and think about, it was my Monday yesterday, it was also his. So I was able to just, you know, stop and think, and rather than react with the smart comment about eating bonbons, to respond in a more constructive way. And, you know, why do I tell this story? I know we've all done this. What I want you to think about is, in that moment, our evening could have gone this way or this way. And I was able to make it go this way, which was the good way. So if we can just try and do that to the best of our abilities, just on a daily basis with our people living with dementia, it's going to be of benefit to everybody. So it's worth the time. And by the way, we're not perfect, and I certainly am not. So I've had many a night where I've made the bonbon remark instead. So, you know, we're human. So let's see here. So communication is more than just language. And really, I guess that's just what I've been talking about. It's, you know, it's tone, it's facial expressions. It is the context of things, you know, everything that you're kind of carrying with you in that moment. And so if I had a tough day yesterday, and it wasn't a tough day, but it was a busy day, my tone in responding to my husband could have been very like sarcastic, which is kind of what I was thinking. So we need to think about how all those different things, how we are using our voices, what our facial expressions are, and our posture even, you know, are we, look at, I just did it, I didn't even realize. Shoulders tensed up like this. What am I communicating when I do that? Tension, some kind of tension. So that's obviously body language and movement. And of course, our physical interactions that we're having with people as we are communicating. A little more challenging now with shelter in place, but we certainly are still having some physical interactions with people in our homes and in our communities. And these play into all of what we're saying verbally, but also with all of our bodies. And then, of course, our behavior. And again, just to acknowledge that this has been challenged here with the pandemic, because we are wearing masks oftentimes when we're out and about. And we're also doing all these kind of things via Zoom. And that is affecting and limiting our ability to take in that information that we do just very naturally. Now, I mentioned this, and it's not really a mention, I really want to emphasize it, because what we will come back to, and as Amy has already talked about, we know that our people living with dementia rely heavily on visual cues, which is what we're talking about, the facial expressions, what the eyes are saying, what, you know, am I like this, or am I, you know, open and smiling? What is, you know, you see I'm using my hands, and I do use my hands a lot. What our bodies are saying, you know, do we look open and engaged, or are we distracted and frowning? So our people living with dementia rely heavily on these things, and that's really important for all of us to remember. So what are some things that we can do? Well, we want to for sure maintain good eye contact and physical position. And I want to just, you know, ask you, any of you, have you ever tried to have a one-on-one conversation with somebody who won't look you in the eye, who's either busy on their device or is looking around elsewhere and just is not looking at you in the eye? And I want you to think about how that feels. How does that feel when somebody won't meet you eye to eye? Now, I know for me, it makes me feel very uncomfortable. It makes me feel that they are not with me, that they are not listening to me, that they're not interested or engaged. So please make sure when you are, in as much as possible, when you're communicating with your folks living with dementia, try to really make yourself physically present and in front of them and with good eye contact. Now, can we do that all day, all the time? No, but in as much as is possible, and especially when you're really looking for a connection with your person, these are the things you need to do. Offer an introduction, even if this person is, you know, somebody you know very well and love, and your assumption is that they know you very well too, because sometimes they don't, sometimes they forget who we are. So give them some context. So, hi Mom, it's Jean, your favorite daughter. So, you know, I'm saying my name. I'm saying we have a relationship, that I am your daughter, and I'm saying I'm your favorite. So I'm kind of giving some context as to the kind of relationship we have. So whether any of that actually is true or not is actually irrelevant. So we want to give people living with dementia the context of who we are and why we're in front of them. Pay attention to your tone and volume, and keep it, I'm just going to say friendly, and a kind of a happy tone, in as best as you can, a loving tone. The one interesting thing about volume is, and I always think back to a gentleman that Amy and I worked with, and Amy, you'll recognize this right away. He said, you know, when he was early in his journey with the disease after he'd been diagnosed, one of the interesting things he found in interacting with people is people started to speak louder to him. And he would say, you know, he was really good about this. His response to people was to say, I have dementia, I'm not deaf. You know, because sometimes we add volume to things when we're trying to get people to better understand what we're saying. So, you know, modulate your volume for sure. Allow plenty of time for communications. And this is probably just is probably good advice and makes good sense all around, for us to not be so quick to react, but rather to think and respond. But we really need to be aware of this in terms of our communications with people living with dementia. They need extra time to think about and process what it is that has just been said to them, And they also need extra time to think about and process what their response is going to be. So slow it down. And for sure, consider other ways to communicate, with the other senses. It's not just verbal. And we are going to come back to this and delve into it just a little bit more. So, but I want you to be thinking about that. Other senses. Okay, so what are some techniques? So this one I love. Use short, clear sentences. And, from Teepa Snow, the really kind of amazing woman, not just kind of, she is, that Amy and I learned from in getting our positive approach to care certification. Teepa says, talk less, listen more. Again, probably some good advice just for life in general. And very important for our folks living with dementia. Simplify your instructions and limit your choices. I think, again, we just, by nature as human beings, when we feel people aren't understanding us, they're not getting it, we tend to elaborate and give more detail and more information with the thought that that's going to help clarify things. And in fact, often with people living with dementia, it makes it worse. Why? Because it's just a whole lot more words and information that they need to try and make sense of in their brains that are being damaged and impacted by this disease process. So we're not helping them, we're making it worse when we're throwing more information at them. So talk less, listen more, simplify, choices, give choices. 2 choices is great, 3 is okay, 2 is great. This or this. Do you want to wear this or this? Would you like to have soup or a sandwich? Because when we leave it wide open as to what people would like to eat or drink or where they would like to go, that can be way too much information as well, overwhelming to make a choice. So therefore you don't make a choice at all. You say, no, I'm not, I'm not hungry, or I'm not thirsty, or you just do nothing. That's the default position that we often see in our people living with dementia. Address the person directly. Say their name, get their attention, get their eye contact, and then begin your communication. And for sure, avoid any kind of baby talk or elder speak, unless it's a person you have a relationship with and you've communicated that way, prior to the onset of dementia. But if you don't have that kind of relationship and you've never been invited to speak that way with the person, then for sure don't do it. And I have to be honest and say, I tend to a little bit with people that I like to call them dear. With people I really like, it's a term of endearment for me. And I have to myself sometimes put a filter on that and remember and understand that not everybody's going to be taking that as a term of endearment. It might, to some people, feel like it's maybe condescending, or there might be other kind of meanings behind it to people. So we have to think about that in our communications. So what are we going to try to not do? All right, folks, don't argue. How easy is that? It's not. Why do we argue? Well, again, we argue because we want people to do something that is unlikely in the scenarios we're talking about in people living with dementia, it's likely something important, like take a bath or take medication, something like that. We argue because we want them to understand why we're trying to help them. We argue because we want them to recognize that they need our help, that they've got dementia, that they don't remember. But again, I'll ask all of you folks, how many times have you had an argument with your person living with dementia and it hasn't solved the problem. It hasn't made things better. And in fact, it's made things worse. And I will venture a guess that upwards of 98% of people will say, yeah, that's true. Arguing hasn't worked and it has made things worse. And, you know, perhaps even inching more up to 100%. It's just a communication, I'm not going to call it a technique, a communication setting that we all have within us, but it's rarely effective in terms of communicating with our people living with dementia. So don't do it, folks. As best as you can, don't do it. Don't correct the person. So, you know, I just want all of you again to think about when you get corrected by someone, whether it's someone you love or a colleague or really anybody, and think about how does it feel when we get corrected. Amy, can you tell me how it feels to you when you get corrected? No, Amy, that's not, you didn't do that correctly. You didn't do that right. You need to do something different.
Yeah, I mean, it feels like I've been sort of shut down. Sometimes it feels like I'm being talked to like a child. Yeah, I feel disrespected sometimes.
Yeah. You shouldn't do that, Amy. You should do this. Now, look, there's some ways in our communication, you know, where we can get, what do we call it? It's help, you know, however we term it, helpful feedback or constructive criticism or constructive feedback. You know, all those things are important. But the thing is, that's for all of us with healthy brains that are able to think this through and use our powers of reasoning to say, okay, this person is not trying to put me down. They're trying to point out something where I could do this or that in a perhaps better way. Our folks living with dementia don't have that option because of the damage that's going on in their brain to be able to use those reasoning powers. So what are they doing? They're being corrected, and in the moment, it doesn't feel good. It feels like I'm being treated like a child or I'm being shamed. And, you know, it's embarrassing, even if they do, you know, have some insight into, oh, I didn't do that the way I should have. It's just plain embarrassing. So we don't want to be correcting people. And that ties in with reminding them that they forgot. Absolutely not helpful. Of course they forgot. That's the nature of the dementia. That's their disability. If you have a broken leg and I tell you I want you to go run around the block right now, and you say to me, well, I have a broken leg, go run around the block. You know, and we get into this back and forth. You're like, I can't, I have a broken leg. And I just am pushing, go run around the block. So broken leg, I'm not going to say broken brain, but it is an injured brain, injured by disease. So let's not go, over and over saying, don't you remember? I told you this. No, I told you that. Did you forget? Did you write it down? Don't you remember? We do tend to do a fair amount of that, particularly I think early on in our journey with a person living with dementia. where this is some of the important stuff that we need to unlearn in our communications with folks with dementia. So don't remind them that they forgot. Quizzing their recent memory is, if I may say, I mean, we all have done it. You know, we look at photographs and say, well, who's this and who's that and who's that? I'm just going to say this, and I'm also saying it with a kind and generous heart for everybody out there. But if we continue to quiz recent memory of folks with dementia, it actually, I feel, is just downright cruel. Because that's the thing that they cannot do. It's not there for them. Their recent memory. How can we ask people to do something they cannot do? We just can't. So really try and work hard on that as well too, folks. And here's the best of all. We're hardly asking anything of you folks. Look at this list. Lastly, don't take it personally. Wow. Easier said than done, right? All of this easier said than done. And I want to acknowledge that. This is tough stuff. And we don't learn it and acquire the skills overnight. No, 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 no way. So, you know, we're with you in that. Amy and I have both been in this field long enough, and we've worked very closely and on a personal level with many clients over the course of the years. And we've made these mistakes, trust me, sometimes more than a few times. So I don't want to sound like I'm being preachy in a sense, because, you know, I mean, I've been there. I've screwed up many a time myself. So we're with you, and these are the things that we want to help you, the skills we want to help you acquire. And as far as taking it personally, that's something I think that you acquire over time. It just doesn't happen overnight. It's, you know, your skin gets a little tougher with time, and that's a good thing, and it's also a sad thing, because it's also showing, you know, that we are adjusting and accommodating, which is good, and it's also sad. But it's an important part of how we can actually really give our best to our people that we are caring for and loving, who are living with dementia. So I hope that makes some sense to folks.
Jean, I just want to offer a quick point of clarification. We've gotten a couple of questions about what you mean by elder speak. So I just wanted to define that term. You know, baby talk is, we know what baby talk is. Elder speak is a term that refers to when you refer to an older person as sweetie or honey or dear, like Jean was describing, sort of talking down in those sort of sweetie types of terms, because they are an older person. Mm-hmm. Not because that's what you call them or you find them sweet or dear, but you know, it's kind of the verbal pat on the head, right. And it's the elder speak is just the term we use for that. So please keep moving. I just wanted to explain that.
Sure. And I just do see a comment here, which we will come back to, about some of the things I've been talking about, but also, you know, assisting the person living with dementia and using their brains. And, you know, we do want to do that. We do want to engage with folks, but we need to be careful in terms of how we do that and what our expectations are. So, and questioning memory, you know, quizzing people is not really that effective, but we'll talk about some things that are, which we're going to do right now. So, you know, how do we employ all this information? How do we apply it? Well, let's start communication-wise with trying to frame statements and requests in a positive and loving manner. So just as it says here on the slide, please do this versus don't do that. And again, I think this is just good advice in general for life. One of my colleagues, she said this, I'm quoting her, she said, communicate and speak not just with your voice and your thought, but with your heart. And so again, just thinking about, I think if you slow it down and think a little bit about it and just be polite and kind in your conversations, you will go a long way. And that is part of bringing to your communication your spirit of generosity and forgiveness with our folks living with dementia. And again, understanding and adjusting expectations of what our people can do. And absolutely, kindness may be more important than honesty. We talk about this a lot at Alzheimer's San Diego. And we do have some questions that have come up, which we'll get to towards the end of our presentation, where we're going to address this very specifically about where we will illustrate that kindness is more important than honesty in terms of answering some of those and responding to some of those tough questions. So we want to focus on the feelings behind the words, not the facts. And, you know, we want to be paying attention to the emotion that's behind the words, and that the emotions may be telling us more than the words are, okay? So if I tell Amy that I'm feeling anxious today, you know, I mean, that's pretty clear. She hears me. Maybe I'm communicating it with my body language as well too. That's quite likely. Amy, I'm feeling really anxious today. And so she's getting the facts, and she's hearing the feelings and seeing them as well too. And so, you know, that's pretty easy information to take in and respond to. However, if I am saying, where's my baby? Where's my baby? Amy, where's my baby? Where's my baby? And Amy knows I don't have children. And so how does she respond to that? Does she say, Jean, you don't have a baby? What are you talking about? There's no baby. You don't have babies. Or does she say something like, Jean, you're worried. You're worried about your baby. And then maybe she delves a little bit deeper, and she comes to find out, which she would likely already know because she does know me, is when I'm saying, where's my baby, I might be referring to my dog, because my dog is kind of my baby. So, so just an illustration there about, you know, it would be easy for Amy to just say to me, yeah, you don't have a baby. There's no baby here. There's no baby crying. What, you know, what's up? But instead she responds to what she sees in me, which is anxiety, concern. I'm voicing concern about a baby. What is the baby? What? She delves further and she discovers it. So that's what we mean by focusing on the feelings and not the facts. So, and what I just illustrated here with my pretend conversation with Amy is validation. In the first instance, she's telling me, basically she's telling me I'm wrong. There's no baby. there's just, I'm not getting anything good from Amy in that communication, because I'm not being heard, I'm not being understood. And in fact, I am being shut down. So in the second instance, I'm being validated that she sees and hears my concern and my anxiety. She might not understand it just yet, but she sees it and she hears it. And those are the first steps towards understanding it. So validation is that affirmation that what I am experiencing is real and true, and that the person I'm communicating with is witnessing it. And so they are giving me some agreement and some reassurance. Your baby, Jean, you're worried about your baby. Should we go look for your baby? Maybe she doesn't know just yet what my baby is, but she's saying, let's go look for your baby. I'll help you find your baby. She's giving me understanding, and she's giving me empathy. She's giving me her generosity and her compassion. And that is really all that we need and want. It's not all, but it's a large part of it, isn't it? Wouldn't it be great if we had this almost all the time? A good portion of the time is validation. All right, so now we're going to do a little bit of a illustration here for you that is not going to be pretend between Amy and I. We're going to really do the thing. So, Amy, will you be my care partner here?
Yes.
Okay.
Wait, I'm the care partner?
You want to be the care partner, or you decide?
Be the person with dementia. No,
okay.
No, I'll be the care partner. Sorry.
Okay.
Got confused.
All right, so Amy's just put a dish in front of me. It's lunchtime. And she's put a dish in front of me, and I am saying to her, I don't want to eat this. I hate chicken.
What? No, you don't. I just made chicken for you last week and you ate it all up. You've always loved chicken. No, I'm not making anything else. You love chicken.
No, I hate chicken. All right, so what has happened here in this communication? What am I really saying when I say, I don't want to eat this and I hate chicken?
Yeah.
Feel free to throw in some responses into chat. I want you to think about that, what it is that I'm saying. And then I want you to also throw into chat what it is you think Amy is saying. What is in her response to me, which I want to try and pull up here.
Yeah, there's a couple people have said, I mean, by saying, I don't want to eat this, I hate chicken, you might be saying, I'm not hungry. This doesn't sound good to me right now. Yep. Oh, I like that. I just don't want chicken today. Right?
And
there's a difference.
Yeah. Eat something else. And in Amy's response about, I'm not making something else, you told me you wanted chicken, I'm not making something else. What's the context of that message? What is behind that?
You're upset, anxious, not feeling well. Yep, that's a great response. These are the words of I like it, a resentful care partner. Yep.
I don't want to cook anything else. I'm tired.
You're wrong. I'm right. I've got the facts right.
So it wasn't a very successful communication with Amy and I about this lunchtime meal that she's made for me, was it? So what is a way that Amy might respond to me that is more validating to what I said originally, which is, I don't want to eat this, I hate chicken? Throw some ideas in chat. Amy, what do you think might be a more valid? more validating response.
If I don't need to get hung up on the fact that I know you like chicken, right? I can validate the fact that you don't want chicken right now. That's all that matters. You're telling me you're not hungry, you don't want this. So I say something like, oof, you're right. I got so busy, it totally slipped my mind, right? Let me go look and see what else we have, right? I know I'm not really gonna prepare an entirely new dish, but maybe I can come back later. We've let this go. Now you're hungrier and I'm gonna try it again.
Right, exactly. So, again, you know, when we go into it with an agenda, which is, you know, I made this dish for you, and, you know, we're thinking I'm not making anything else. It's like, this is it. You know, we're right away affecting the communication and making it stop. So we need to be careful that we are validating. It doesn't mean we have to go back in this instance to make something new, but to be doing some of the validating responses that you folks were writing in chat about, you know, that you don't feel like chicken today, or maybe you don't feel like eating, or you just want something different today, or maybe it's just not time yet to eat, and to go back and try again later, perhaps. So think about the ways that you can validate with your response and make it a better communication. All right. How about this one? You didn't tell me I had a doctor's appointment. I'm not going.
Well, of course I did. I called you 10 minutes ago and told you I was coming over. Look, it's right here on your calendar. I wrote it down. You go to this appointment every 3 months. I definitely told you about this appointment.
Wow, what a barrage of information. Mm-hmm. Not going with the talk less, listen more.
Anyone that knows me knows that's my biggest struggle.
Yeah. And, you know, we hear about this one a lot. So, and it's everything. Yeah. All the things that Amy did that you forgot, you've been seeing this doctor, all those things, none of it's validating. A better response might be,
oh, did I forget? I'm sorry. I have been really busy. I may have forgotten. It slipped my mind. But you know what? There's no rush, right? We've got plenty of time. Let's find you something comfortable to wear, and we'll head out.
Sounds good. Yeah, way better. So it's just like apologizing, even though you didn't do anything wrong, Amy. Yes. But you're taking the blame, and you're validating that you didn't tell me, even though you did. And you're also kind of reassuring by saying we've got plenty of time, and, you know, let's get you something nice to put on or whatever it might be.
Yeah, notice in both examples, I started with an apology. Right? Yes. You can be very direct about that and say, I'm sorry. Or, you know, there's sort of other indirect ways you can acknowledge, like, this was my mistake. This was my error. It wasn't, right? That's sort of an unfortunate thing about this situation. You are taking the fall, you're taking the blame for things that aren't your fault. But you're both going to have a much better day if you just simply apologize.
Agreed. So there it is, more yes and less no. That's the takeaway there. So we're going to turn it back here to Amy, and she's going to talk about behavioral expressions.
Great. Thank you, Jean. The word behavior, I just like to kind of, again, kind of lay some foundation. The word behavior, we tend to associate it with very negative things, right? It's associated with children who are behaving naughty. They're being naughty, right? We don't necessarily mean something negative. When we talk about behavior, we're just talking about someone responding in a way that is out of character for them, right? That's what we mean when we say a behavioral expression in a person with dementia. It's a symptom of the disease. It's the person's way of communicating, I need something. They might be doing that directly with full awareness. I need you to help me feel better. I'm hungry, I'm thirsty, I have to go to the bathroom. They might be doing this without an awareness. I'm feeling isolated or bored, I'm restless, and so I'm acting out. I'm not directly asking for your help, but I need your help. So when we talk about behavior, in the context of our education programs at Alzheimer's San Diego, we are actually usually talking about something negative because those are your day-to-day challenges. That's where you struggle as care partners. But the word behavior itself doesn't necessarily refer to just the bad stuff that you see on the screen here. So I'll make a plug here for a program, another education program that we offer regularly called Coping with Personality and Behavior Changes. And we'll offer that program again at the end of the month, at the end of July, wherein we'll sort of get into this in a little more detail. But I just want to kind of explain that these behavioral expressions that you see here, these are methods of communication. When language is failing a person, right? When I can't find the words to say, chicken just doesn't sound very good right now, right? What I might do instead is shove the plate, right? So these behaviors are ways of expressing something I am either not totally clear on in my mind, or I just haven't found, I'm struggling to find the right words for it. In responding to a person's behavior, we want to start by looking, is there something physical going on with this person? Might there be something medical underlying this sudden change in their behavior? Is there something in their environment? Is there something emotionally that they need? We'll talk a little bit more about these different triggers here. First, we want to see, is there some need I can meet? If there's not, let's just acknowledge this person is uncomfortable. They need something. That's the validation that Jean was talking about. Our goal always is redirection. And I've seen some beautiful examples in the chat of how some of you have done this, right? Just remove the plate for a few minutes, get them thinking and talking about something else, and then bring that plate of chicken right back, right? That's redirection, and it's a wonderful strategy, but we can't start there. We can't, just let the person not feel seen, not feel heard, not feel understood first. So first, in responding to those behaviors, we want to look for, is there something physical going on with this person? Are they hungry? Have they just been sitting or laying down for too long? Do they need to move? Do they need to use the bathroom? Are they feeling restless? Might there be something medical going on, an underlying infection, an illness that is brewing? In individuals with dementia, we're very likely to see cognitive changes or behavioral expressions before we actually see physical symptoms. A urinary tract infection is a very common example of this. In the general population, you'd normally see, or they would experience, right, burning with urination and increased frequency of urination. In a person with dementia, the first symptom we might see would actually be agitation and combativeness and disorientation before any of those physical symptoms emerge. So recognize that when there's a very sudden change and a very dramatic and quick change in a person's behavior or their level of functioning, we do want to assess, might there be something medical going on? It is important to talk with the doctor about that. An infection, an illness, some kind of a cardiovascular event or a stroke, or might this be depression or anxiety? Of course, there are emotional triggers, as Jean gave some really nice examples of this, right? People feeling fearful, feeling frustrated, feeling isolated, or bored. That will frequently trigger a behavioral expression of some kind. And then finally, the environment. Is there something in this person's environment that we can change? That could be something physical, but it could also be, it could be the fact that you're tired, you're frustrated, the way you're communicating, right? If you are not employing these sort of patient and compassionate communication techniques, you could be contributing to that person's behavior, right? Talking too much, being too loud or animated in your speech. Right? So if there is something in the environment that you can change to declutter, to help them feel more familiar, great. But kind of check yourself as well and see if you might be you might be one of the triggers. So let's talk now about that validation technique, right? That's, we've assessed, is there some kind of trigger that I can actually meet that need and that makes the behavior go away? Great. When there's not, right, we start with validation, or maybe there is a trigger. We just in this moment can't quite figure it out, right? We do our best detective work, but we can't always figure it out in that moment. So to validate that person, we respond with calm, with reassurance. That is to say, it's okay with me that you feel this way. It doesn't mean you're right, right? I don't have to acknowledge, no, you have always loved chicken. You told me that you wanted chicken an hour ago, right? By just simply saying, okay, that doesn't sound good to this person right now. It's not what they want to eat, right? Responding with calm, with reassurance, communicating that you understand even when you don't, right? We've all done this, right? We tell these little lies to each other and to ourselves all the time, right? How are you doing today? I'm doing fine, right? How often are you actually doing fine, right? Just letting the person know, I see that you're uncomfortable, right? Maybe internally, I'm racking my brain and trying to figure out, gosh, they've eaten, they've had water, they went out for a walk, they went to the bathroom an hour ago. What could this be, right? In that moment, what they need to hear from you is, I see that you're not comfortable. I'm going to try to help you, right? That's when Jean talks about focusing on feelings, not facts. That's the essence of validation. And only once we've done that can we redirect the person. When we get to that stage, we validated them, we've kind of de-escalated the situation in order to keep it from coming back, right? We do want to have some sort of tools in the toolbox for redirection, if you will. So I ask you to go back to that list of things you thought about, wrote about, or even some of you submitted some wonderful chats about. Think back to those things about your person that haven't changed, right? This can be a wonderful source of thinking about tools, tricks, techniques for redirection, right? Oops, sorry, get my cursor working here. Great. Okay, so you're thinking back to that person. The things I remember seeing in the chat, there were folks who loved hugs. There were folks who loved chocolate. I saw a beer on the patio. I saw lots of, there was some cooking, right? I saw lots of activities and things about your person that are specific to them. Think about ways that you can connect with them through the senses, right? Somebody, you know, Jean loves her dogs, and I'm talking, she really loves her dogs. Right? Jean will always be someone that you can connect. You can put a dog on her lap. You can give her something that even just looks like a dog, right? And Jean's going to respond to that. The feel of golden retriever fur, something very special, right? The sight of those sweet, sad puppy dog eyes, right? The smell, maybe a freshly bathed dog, I don't know. The smell of a golden retriever, maybe not so much, but right? Everybody's got their smells that they respond to, those chocolate chip cookies or chocolate or coffee, or, you know, you can see in my mind, it's all food smells, but there's also, you know, the smell of trees, pine trees, right? What are those things that really make your person come alive, that connect to those things about them that haven't changed, that they love? Food, tastes, but also sound, right? I see right there in the chat, music. 50s R&B, someone is saying, is a way that they can connect with their person, right? That's very person specific. That wouldn't work with my mother, for example. That's not her particular thing that gets her excited, right? But I can turn on the yacht rock for my mom. That's her that's her sound. That's the music that sort of speaks to her soul. So think about your person, the things about them that haven't changed, that make them unique, and consider these the things that you can keep in your back pocket, right? You've de-escalated that situation. You worked through, is there something physical? Is there something environmental, emotional that we can work through here? No, I've at least told you, I see you, I hear you, I know that you're uncomfortable, and I'm here to help, right? We're gonna get through this. If that's all you can do in that moment, that's all you can do in that moment. Now that the person has felt heard and reassured, let's get out that, in my case, the Sound of Music DVD, right? Pop that thing on and my mood is going to brighten immediately. Let's go find the golden retriever and bring it in the room and have it sit down next to Jean and provide her with some comfort, right? The redirection tools work once we have already validated that person and provided them with some reassurance, right? That they are understood. So we're going to pause here and go through some of these wonderful questions that have been coming in. Jean, do you have any in particular that jump out at you?
I do. I'm kind of put several together because they're very similar. And basically it's, how do you respond to a person living with dementia who is saying things that maybe aren't real or can't happen? And so, for example, that they want to go home. We hear that one a lot.
Yes.
Or another one was that the person, well, and I guess this might be the same thing, go home. In this case, they actually are planning, the person living with dementia is planning on moving back to their home country, which is not feasible. It's not going to happen. So how do we respond? And I guess this is within the realm of, use where kindness is maybe a better response than honesty. So can you give us some ideas on that?
Sure. Thank you. Those are really important questions and a very common experience in a person with dementia. Most of us at some point in caring for someone who's living with some progressive form of dementia, you're going to hear those words from the person at some point. I want to, this place is fine, but I got to get out of here. I want to go home. Right? I want to go home. There's the words, there's the facts, right? And we can argue those facts all day long. This is your home, right? You've lived here for 20 years. Or remember, we sold your house and we got you this nice new apartment where these folks are here to help take care of you every day, right? There's all those facts that we can apply to this situation. But let's remember that person's level of insight, right? Think back to that pie chart that I showed you earlier on in the program. Where are they right now? Do they know that they have a memory problem? Do they know that, if my telling you, you are home, this is your home, is that going to trigger for them, oh, you're right, I just forgot, right? In all likelihood, no. Are confronting them with facts and arguing and trying to convince them that they are home, or trying to convince a person that, traveling back to their home country, that in their mind, that's the definition of home, right? Wherever it is that they think they need to be, that's their definition of home. Trying to argue that out of them is not going to be effective, right? So instead, focusing on the feelings. So Jean, what would you say? Somebody who's saying, I want to go home, what might they really be saying?
That I'm not feeling secure and comfortable where I am right now.
Yes, exactly. That's what I would think too, right? I might be disoriented. I might, my definition of home might just be a different house, somewhere I lived in another time, or it might be that other country, right? Who knows? But what really matters here, and Jean, I think you got to it, right, is that where you are right now is not where you want to be. It's not where you think you should be. So if I can say something that validates that feeling, that makes it okay, that just tells you, I understand, right? I know this place, it's a little cold in here. Why don't we warm it up, right? Finding some way to say to them, right? Let's put some new things on the walls. This doesn't feel like home, right? Saying something to that person that just lets them know you see, you feel with them, you can empathize and understand why they don't want to be where they are right now. That's going to go a lot further than hours and hours of trying to make a case for explaining to them why they already are home or why international travel is simply not happening, right? We don't need to negotiate that, right? Oh, yes. If it's they're originally from Italy and that's where they think that they're going to go, right? Get them thinking about how beautiful Italy is, right? Don't be afraid to go there. It's okay, right? They're thinking about that place anyway. Talk with them about it. Oh, I see why you miss it there. It's lovely, right? Start talking about home together. That's going to go a lot further than arguing.
We just had a lovely comment come in from an attendee, says, with regards to this example we're giving, is what about putting on music from their country and looking at
Ooh, I
photos from
like
their country?
it.
I do
You
too.
you're feeling like you want to be home, right? Let's bring in some little elements of home. Yeah. Yeah. So you can see, I mean, much of what I just said in my example probably totally wouldn't fly. It wouldn't apply in your specific situation. You have to know the person and what might motivate them and what are those individual things about them. Mainly, you have to know what emotion, what feeling are they really expressing, behind those words. Yeah.
I
Great.
have another really good and a really important question, I think, Amy, and it's a care attendee who is a care partner as well too, speaking to the lack of concern for any of the care partner's needs, i.e.
Mhm.
need for sleep, need for rest, need for time out, um, all those different things. And can you kind of give us some ideas how to respond and how to tie this in? I think you talked about, the seat of empathy being,
Mhm.
it's a function in the brain that it is being impaired by the disease. So how do we deal with this situation
This
where they're
is
not
so hard.
of or have any empathy for how we are feeling as care partners?
Right. Thank you for the question and the comment. It's a really important one and probably something a lot of you are dealing with, right? I have needs. I need to eat lunch. I need to get a good night's sleep. I need a little time for myself, right? You do have those needs. Unfortunately, we can't force people with dementia to understand those needs or to meet those needs, right? They are experiencing disease. In the same way, think about Jean in that example of the person with the broken leg, right? We wouldn't force somebody with a broken leg to help us with our housework, right? Because I'm overloaded and I need you to help me with this. Yes, I need some help. I'm gonna have to find somebody else to provide that help for me because my primary source of support right now has got a broken leg, right? So think about the person with dementia. They're there, right, to be, you have a relationship with them. If it's your spouse, if it's your parent, your friend, your neighbor, right, let them be that person to you. But they are unfortunately not in a position to meet your practical needs anymore, right? So we can't demand empathy from other people. We can't demand that they develop insight into their own disease process. We also can't demand that they develop insight into our needs. So we have to kind of let that go. Take a deep breath, recognize this person who seems kind of self-centered and doesn't worry about me and my needs anymore. That isn't because they don't love me and they don't care about me. It's because they have a disease in their brain. I need to get those needs met elsewhere in my life, right? If I need sleep overnight, I'm going to have to figure out some respite, right? Does that mean having somebody come in overnight to help me? Does it mean considering a residential placement option, right? Whatever that might mean, I can't force this person to cooperate with me. Yeah. Probably just time for one more.
Okay, and this is a good one. How do we respond to somebody living with dementia? Every time we ask them to do something, the answer is no.
Mm. Whew. Uh, well, I think I'd need more specifics to come up with a creative response. But first, I'll just make a plug for, we have a class on this topic. It's because it's such a common one. It's called Managing Resistance, because saying no is a very common response in people with dementia, a very common reaction, I should say, in people with dementia. No matter how well intended, how well meaning your suggestion might be, no matter how much they love that golden retriever, but they don't feel like getting outside for a walk right now and they just say no. This is that person's way of keeping some control over their environment. So recognize it as such. And, first of all, realize that you can't force it, but look for the meaning behind that no. right? If the person is telling you no, 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 is it because they don't really like your tone, right? They don't want to be told what to do. Remember me bristling at someone telling me how I did something wrong or what I should be doing. None of us like it. They probably don't like it from you either, right? So are they saying no because they want to feel more autonomous, more in control? Are they saying no because they don't really understand the request? And so it's just easier to say no, right? So consider the nature of the no, and then formulate your response based on what you think they're really saying with that no.
Great, thank you.
Yeah.
I think we'll probably move along now, Amy, if that sounds all right to you.
Yep.
We got
I think you have the remote.
running a little bit late here, so we want to get through this last little bit here. So, okay, and this is just summarizing what Amy has been talking about, and what I hope you've all been hearing throughout this is you can't pour from an empty cup, folks. You need to do what it is you need to do to refill and refresh and renew your spirit. And that means, of course, taking care of yourself. I think we all know these things and we hear them on a regular basis. And sometimes we just need some poking to make sure we're doing the best we can with regards to all of these areas of, eating well in a nutritious fashion most of the time, and getting our exercise, working to manage our stress levels the best as we can, and keeping some things going in our lives that are providing social and cognitive activity for us that's outside of the realm of dementia. So we can be kind of renewing ourselves as well. And that's for whether you're a person living with dementia or a care partner. And, also be seeing our healthcare providers on a regular basis. Make sure we're on top of things. There we go. So we build your support system. That's a hugely important part of taking care of yourself. And so be looking at your support system and thinking about how you can grow it. More is better, especially if you are a care partner to somebody living with dementia. Ask for help when you need it, folks. And keep the connections, again, that feed your soul. Do think about attending a support and discussion group. And we're going to have our colleague Brooke come in and speak to that in just a few minutes here. Make sure you get your daily breaks. And I'll tell you, we've got this fantastic program that is our ALS Virtual Companions. This is where we have volunteers that have been trained that we will match to you as families and as couples and for the people living with dementia. And the intent is to just have this friendship, this connection, this time together virtually with the ALS companion volunteer. And it's been a hugely successful program. We went virtual, obviously, with the pandemic, and in that short period of time, we are now serving over 50 families virtually. And folks, we have volunteers trained and ready to go. So, if you think this could be something that could work, please give us a call and we will happily get you matched up with volunteers and utilizing this program as well too. So here's all the different things we do, and there's a lot. Please feel free to go on our website and have a look around and see all that we do. Call us as well. If you don't know what it is you might need, then for sure call us and we'll get you directed accordingly. And now I'm going to turn it over to my friend and colleague, Brooke, who's going to tell us about the new support group that we have started that Brooke is one of the facilitators for.
Yeah, hi everyone. I'm one of the social workers here at Alzheimer San Diego. I'm going to be facilitating this new group we have. So this is for anyone who has a person living with dementia in a residential facility. So that could be assisted living, memory care, skilled nursing. We really recognize that having someone in a facility brings its own unique challenges and experiences, especially with what's going on right now. So we're really wanting to give that space to be able to share those kind of experiences. So if you're interested in that, it's going to be every second and fourth Thursday from 10 to 11:30 a.m. Virtually. And just give us a call if you're wanting to sign up for that.
Great. Thank you, Brooke.
Thank you, Brooke. Jean, I just want to say, if you're interested in learning more about Brooke's new support group, about our virtual All's Companions program, or anything else, I put a link in the chat. I'll type it in there again here in a few minutes, but just click that link, put in a little bit of information, tell us what you're looking for, or even if you don't know what you're looking for, just put your contact information in there, tell us how to reach you, and one of our social workers will reach out and get you that information.
Absolutely. And again, here's just the different ways to contact us. We know you have lots of questions. We had lots of questions that we weren't able to get to today, but that doesn't mean they can't be addressed. So do reach out to us in all these different manners, and you will be able to speak with a social worker or email with a social worker to get some ideas that are specific to your situation and the challenges that you are encountering. So please get in touch with us. And then lastly, we do welcome your feedback. And so Amy's going to send, actually it's a link that will come out after the program is over. And just for you to give us your feedback on today's presentation and how we can make it better and more effective for you. And we do appreciate your honest feedback. That's what helps keep us on our toes and keep us improving. The copy of today's program will also be emailed to all of you, so you'll get that in about a day, I think, if not even sooner maybe. And be aware then again of our upcoming education programs next week. On Tuesday is Legal and Financial Basics. And then on Thursday, July 30th, the kind of sister program, or one of the sister programs to this one, is Coping with Personality and Behavior Changes. And we thank you today for being with us. Thank you for bearing with us as we went a wee bit over time here. I'm pretty good at talking.
A skill set of both of ours, for sure.
Yeah. So we'll stay available here for a minute or so if you have any pressing questions, and we thank you for being with us here today. And stay connected with Alzheimer's San Diego, people. We're here for you.